us and we're getting ready to start the IV. So we, of course, come into our patient's room and knock on the door, introduce ourselves to Mr. Hand, and explain to him the procedure that we're going to do. Mr. Hand, you're going to have an IV started today. Have you ever had one before? You have? Well, that's great. What we're going to be doing then is we're just going to be putting a cath on into your hand to run some fluids in. So let me go ahead and wash my hands real quick. Is there any, are you left or right-handed? Okay, so let me know if on this arm you have any reason that I can't use this arm for IV sticks. Perfect. Any allergies, anything to tape or anything else? None? Great. So what you're going to bring with you to the room is you're going to have your IV fluid. You've already spiked your primary bag down at the nurse's station with the appropriate fluids. Always get everything set up at the bedside. And you bring with you, you need a pair of gloves, one that fit pretty firmly. A Cathlon. Now on our mannequins we can only use a 22 gauge Cathlon, but you're going to want to use the Cathlon that's appropriate for what your patient's needs are. And we only use a 22 on our mannequins because a larger Cathlon will actually damage their skin even more. And then you usually have more than one if you're going into a patient's room. And then you bring your IV start kit. So let me just show you a little bit what's inside your start kits. So you're going to open this up. And you're going to look, there's an information sheet. You have your tape that you're going to use. You have your label that we'll fill out once we're finished. You'll have your chlorhexidine, which is what we're going to clean the skin with, non-alcohol, but chlorhexidine. You're probably going to have some little stabilization device in it. We don't ask that you use those. Not every facility does, but so that part you can just discard. You're going to have some gauze because you might make a little bit of a mess. And then, of course, you're going to have your OpSite that's going to go directly over the skin and the Cathlon. And then, last but not least, you've got your tourniquet that you're going to put on. So I'm going to go ahead and set up all my supplies. So we've already talked to our patient and explained. I usually don't put my gloves on right now. Usually just get everything kind of set out, laid out. And I'm going to go ahead and look first. Just going to go ahead and see what vein I want to use. Now remember, we try to start distal and work proximal. And so it looks like Mr. Hand has a pretty good vein. I want to go about 6 inches above the site that I hope to stick. When you apply your tourniquet, you want to make sure that you apply it so it can be easily released. Pick it up so you don't grab their hair or anything. And make sure that the flaps go upwards so that they're not getting down into the area. So again, about 6 inches away. You can, I can see the vein and feel the vein pretty easily, so I don't have to go through the techniques. But if I couldn't, I can make him drop his hand down below the level of the heart, pump his fist. I could even use warm compresses. So, looks pretty good. Now, I don't want to leave that on a long period of time, so I'll go ahead and get everything set up. Go ahead and put my label out. And get my tape somewhat ready. Some people do put this on, like the bed rails and such. There's a controversy over which is correct. So we want to go ahead and just leave that easily accessible. And I usually go ahead and take my OpSite, realizing that what's going to go against the patient's skin does not need to be touched, but it's a little bit easier to have it upside down so that you can easily grab it. Because you're going to kind of have to work one-handed. And I usually know that anything that's capped is sterile, but I don't want this to be really hard to get off. So once I take that cap off, this is the part that's going to go into the patient. So I don't want to touch that in any way. So I just gently loosen my cap and lay it close by me. Go ahead and open up your Cathlon. Make sure it's loose and easy to get to.